Hello, this is Dr. David Green, CEO of the New Jersey Pain Network. Today's topic is an interesting one. Is my hip pain coming from a hip or a lumbar spine problem? Millions of Americans suffer from hip arthritis, and the pain from it can cause significant disability with a tough time walking, exercising. Close to 300,000 total hip replacements are performed every year in the U.S., and when pain is occurring in the hip area, it just seems obvious to assume that the problem is actually occurring in the joint. Well, this may not be the case. When pain is being felt in the hip, it may or may not be from the hip joint. There can be an overlap in symptoms between hip arthritis and what's called lumbar spinal stenosis. Okay, so as individuals age, spinal stenosis is really common, just like hip arthritis. Both occur from degeneration. Anyway, here's what a healthy hip joint looks like in this cartoon, and then osteoarthritis sets in. You can see, actually it's a reverse down here. This joint looks great. You have nice surface here, no extra bony cysts or anything like that. Here, you really can't even see the joint line at all. It's really bone on bone. Now, with lumbar spinal stenosis, it occurs with degeneration of the intervertebral disc, which then leads to arthritis in the spinal joints. These are the spinal joints, okay? This is the spinal canal, which normally is an ellipse, but here it's more of a triangle because of bony overgrowth, okay? And this can start pinching on nerve roots as they try and get out from the spine, and that can lead to pain that overlaps in the hip. Here's a couple more pictures looking at the spine from the side. Here you have a nice open canal, okay? As it comes down, here you have some overgrowth of soft tissue and bone. So coming in from the front and the back, it can pinch nerve roots as they try and get out. You can see that here, overgrowth of bone, overgrowth of bone. Here the nerve root is trying to get out. It's trying to come out at us. It's getting pinched. We looked at this before, a normal looking hip joint. You can see the joint space here. Here you can't really see it at all. It's bone on bone. There's cysts in the bone. So how do you differentiate between a hip problem and lumbar spinal stenosis? Well, history can help with regards to where the pain is, when the pain comes and goes. Hip and a spine source both can cause referred pain down a person's leg. Physical examination, if they have point tenderness right over the hip, that's more in line with hip arthritis. If they have range of motion pain in the hip, that's more in line with hip arthritis as well. A neurologic exam is not very helpful. Imaging studies, plain films of the spine can show arthritis. It's hard to see stenosis on an X-ray, but an MRI is the study of choice. You can see here you have it's better over here. Degeneration of these joints, and the spine canal is more of a triangle as opposed to an ellipse. Okay. So the best way to tell is through a diagnostic injection, because you may have hip arthritis on an X-ray, but a patient who's not having symptoms from that, and you also may have spinal stenosis on an MRI, but a person who has no symptoms from that. But the best way to tell is with a diagnostic injection. So if you have a hip injection with numbing medicine being put into the hip and maybe some steroid, it should decrease pain very quickly if the hip is the source of the problem. Okay? Now, if the spine is the source of the problem, then an epidural injection can relieve pain very quickly. It may take a couple of those, but it should help very quickly. Here's the potential outcomes. If you have complete hip relief with a hip injection, it's a hip problem. Okay? If you have complete hip relief with an epidural injection, you're dealing with a lumbar spinal stenosis problem. If you have some relief from a hip injection with relief from the rest with an epidural injection, then it's a combination of the two. And there's always the possibility that neither injection will work well. If that's the case, then further investigation is necessary. The top non-operative pain management in New Jersey is through the New Jersey Pain Network. There are several clinics throughout the state, accepting over 50 insurances and providing over 25 treatment options with the board-certified, award-winning doctors. Visit us online today at NewJerseyPainNetwork.com and then call us for more information and scheduling at 844-2NJ-PAIN. I'm Dr. David Green with the New Jersey Pain Network. Your pain stops here.